Hello, everyone. My name is Kateryna Kovalchuk. I'm manager of social projects at Alliance for Public Health, and I'm now working for HealthLink project with my great team, and I'm responsible for the implementing of innovative activities and new ideas in the project. And today I want to share with you the experience of distribution of SafeBoxes in HealthLink project. Actually, I want to firstly start with my contacts. You can see here my contacts. If you have any questions, please feel free to contact me. And I want to begin with presenting my organization and my project, HealthLink project. Here on the slide, you can see our main slogan, impacting the epidemic, supporting communities. The International Charitable Foundation Alliance for Public Health is a leading non-governmental professional organization making a significant impact on the epidemics of HIV, AIDS, tuberculosis, hepatitis, and other socially significant diseases in Ukraine. In cooperation with state partners and civil society organizations, Alliance provides financial and technical support to different programs and projects covering over 250,000 representatives of vulnerable populations. And our mission is to support community action against HIV/AIDS, to reduce the spread of HIV among Ukraine, and also with the help of our effective services and approaches, we strengthen healthcare systems and social services and build the capacity of vulnerable communities. If you want to know more about us, you can visit our website. You can see the link here. And now I want to continue with the HealthLink project. Our project is implemented by CO 100% Live with in cooperation with Alliance for Public Health with the financial support of USAID. And the duration of the project is 5 years. Now it is the 4th year of project. And we work in 12 regions of Ukraine and cooperate with different NGOs and healthcare facilities among these 12 regions. And our project aims are, first one is to improve the access of people living with HIV and risk groups to quality HIV testing and prevention and treatment services. And the second one is to reduce stigma and discrimination against people living with HIV among the general population and healthcare workers. Some words about self-testing in the project. HIV self-testing was introduced into the project in the 3rd year. Actually, before that, only assisted testing in NGOs and healthcare facilities was offered. And we provided self-testing for such target groups as MSM, injecting drug users, sex workers, representatives of groups vulnerable to the epidemic, and also general population. And why general population? Because there could be some representatives of risk groups in the general population that had some experienced risk experience 10, 20 years ago, and now they are in general population, and we need to work with them and test them. SafeBox activity is innovative activity for Ukraine aimed on dissemination of oral tests among MSM in Ukraine to increase their access to HIV self-testing services. Activity indicator for us is number of distributed oral HIV tests among the target group, and duration of the activity is from April 2020 till the present. Our target group is MSM and their sexual partners, including women, all ages, but with a focus on MSM age 30 plus. Why is this particular group? First of all, because in this age group of MSM, the positive cases are most often identified. And the second reason is that such clients don't come to organizations. They don't come to the MSM communities. They are very closed and they can be reached only in social networks, on dating websites where our online outreach workers offer them testing services. Therefore, we began to look for an opportunity to attract such group of clients, offering them safe boxes for testing at home. And also, I want to say that SafeBox activity is innovative just for Ukraine, but not actually for Europe, because we borrowed this activity from our colleagues from Russia, Parny Plus organization. They supported us in our desire to realize this activity in Ukraine, and we have slightly expanded this model by adding some innovative elements in it. So let's talk about some specific features of this activity. The first one is that the activity was planned for 6 regions, and here on the map you can see these regions. But this activity was spread to the whole Ukraine. And reason for this is, first of all, the activity began in April 2020, and this period coincided with a strict lockdown in Ukraine. In this time, most organizations were closed, and it was very difficult to receive some HIV services for our clients. Many clients also have moved to another region to be closer to their families. And the second feature of this activity is that there was no active advertising till now, and social workers promote safe boxes only with the help of Facebook and Instagram, which have no regional borders. And this activity has become very popular among MSM from all over Ukraine, especially from the Western regions. At the same time, I need to say that MSM community is quite close. They communicate online in different social networks, online groups, and they disseminate the information very quickly. And they promote this activity by word of mouth. What is SafeBox? SafeBox is a prophylactic box for taking care of your health and the health of your partner, and it includes confidential box with message, make love, take care, get tested. As you can see, we have no LGBTI indicators, stickers, and signs on the box, and this is important for the confidentiality of our clients. Oral HIV test, condom box, lubricant, brochure briefly about the important where our clients can read useful information about HIV, positive, negative results, PrEP, RVT therapy, and other important information. A business card of social worker and NGO to contact them anytime, and nice motivational things, stickers, magnets, bracelets with motivational messages. You're not alone, my life, my choice, and just recycling package. Where our clients can order SafeBox. Our clients can order page, our clients can order SafeBox by pressing the button receive, or take the test with online instruction by pressing the button start test. We created such innovative instrument to make self-testing easier and most comfortable for our clients. Also, I want to say about some opportunities of our resource. The resource has advantages as for the clients. It's for the project. Let's start with the clients. The first the most important, I think, option is ordering the SafeBox. The next one is online interactive instructions for taking test. Also constant contact with a social worker on every step of ordering or taking the test. Information about HIV and oral tests. Also we have a block of answers to different specific questions. And I think this part of our resource is very important for clients. And the next one is risk assessment. This is also our innovative add to the model. Now every MSM client can take a screening questionnaire on resource and assess the risk of HIV, hepatitis, and syphilis. And we implemented these risk assessments on September 2020, and during September, October, nearly 100 clients assess their risk, and this is very important for us. The next is advantages for the project. Of course, the first one is administration. Administrative part of the resource give us an opportunity to monitor and evaluate indicators for the project and analyze data. Also, we have Excel reports on orders and passing the online instruction by clients. And as you could see in previous slides, we had only 6 organizations in 6 regions that need to operate with all orders from all over Ukraine. And actually, we divide all the orders automatically between all the 6 regions, and this helps us to avoid the conflict of interests and to achieve the indicators. All social workers receive all the orders in their Telegram, what is really very useful and comfortable for them. We also generate and tracking client codes. We collect a lot of personal information about our clients and transform it in a special client code for privacy, and such codes allow us to further track the path of HIV positive clients in our database. Also, in-depth client analysis is important because, as I said, we collect a lot of interesting information about clients, such as has the client been tested for HIV during last 12 months. Actually, if we're talking about all the orders, 70% of MSMs that orders the test didn't do this according to our data. So they 70% of MSM didn't take the test during last 12 months. Also, we ask, for example, who is MSM ordering the test for, and all this information gives us an opportunity to analyze our clients better and to understand them better and more deeply. Now some words about SafeBox's order options. And firstly, I want to start that SafeBoxes is free for our clients. The price that our organization pays for each SafeBox is nearly $14, but for the clients, it is almost free. And the client chooses the most convenient way to get a SafeBox, for example, to get an MSM organization or to receive by mail. And if the client chooses delivery by mail, he pays the cost himself. And actually, I want to also mention that this is not a barrier for our clients because, as I said, the cost of SafeBox is nearly $14 and the cost of delivery is nearly $2. So actually it is not so high and it is not a barrier for clients. During April, July, clients mostly chose the option received by mail because of the strict lockdown. But when the situation began to normalize in Ukraine and organization began to work, a lot of clients came to organization to get a SafeBox, and they were our social workers also gave them a lot of useful information and attract them to other services and activities. Um, and also, I want to say some words about online instruction for taking the test. Is our next innovative instrument that we implemented on the resource. As you know, oral tests are very specific. They depend on external conditions and correct execution. And to avoid mistakes during taking the test, we have created such ideas, such online interactive instruction with the video blogs to help our clients to take the test. And for us, here is very good very good elements. This is client verification, and we client indicates the information in the registration form online, and we can determine which of the clients that order the SafeBox took them using the online instruction. Online instruction gives a lot of opportunities for the clients. First of all, is convenient step-by-step video instruction, a timer of counting the time, interpretation of the result, and ability to stay in touch with social worker on every step. And now I want to share with you the results obtained, and we want to share the results during our pilot period from April till the end of September 2020. And during this period, our clients ordered over 2,000 safe boxes. Also, here you can find the gender and age structure of orders, and I want to say more information about this and our analysis facts. The activity allowed a lot of new clients to the project. Thus, 60% of all orders were placed by new clients. Many clients came to the organization's office to receive a safe box and were included in other project activities and services. 35% of clients ordered safe boxes not just for themselves, but also for their partners using the 1+1 option. And therefore, we managed to reach even more clients. 7% of orders were received from women who are sexual partners of MSM. In the project, we have some limits of such orders, 5-7%, and we have not exceeded. And this is also very important. Also, our next achievement is that 32% of all orders we received from the community of MSM aged 30+. This is very closed, hard to reach community. And this community had very actually difficult access to HIV prevention services. So we reached our aim. Orders came from all over Ukraine. 55% of orders we received from towns, from small villages, remote regions, where it is also difficult to get HIV prevention services, and 19% of these clients have never been tested for HIV. This is also our achievement. 122 clients took the test with the help of online instruction. Yes, this is not so much, but we didn't promote this option to our clients, and we plan to advertise to promote it this year. Our social workers will advise our clients to use this online instruction to avoid some mistakes by taking in the period of taking the test. And as you can see, 21% of the clients pass only the first stage of preparation and then stopped. 28% pass the instruction completely and indicated the result, and 51% passed the instruction completely and didn't indicate the result. And I want to stop on this more in detail. Since the indicator for our project is, and for this activity, and is the number of distributed oral tests among MSM, we didn't set the goal to track the client's results during our pilot period from April to September. Some clients contacted social workers after receiving HIV positive results, but at the same time, social workers navigated such clients on the next step to the medical registration and treatment. But I think it was nearly 2% or 3% of the clients. Mostly, we plan to carry out such analysis in the future through the following steps. First of all, clients provide us, as I said before, very important information during this registration, from which we compose the client code, and in future we will be able to compare this code with our database code and track the positive clients. Also, those clients that indicated that didn't indicate their results on the online instruction form, these clients are potentially clients at risk. And you could see in the previous slides, the number is 51% of all clients who used the online instruction. So such clients could get the positive results, but didn't want to indicate this result in online form. So social workers will contact such clients in future to clarify the result and offer some help if they need such help. Also, we receive a lot of feedbacks from our clients. Some of them thanked us for the activity. Some of them asked for more confidentiality. As we're talking about grateful feedback, I can say that we received over 1,000 grateful reviews. Some of them are here. You can see, thank you for the great service to keep people healthy. Thank you for taking care of our health. Also, we have some clients that need a protection of their confidentiality. So they ask us not to use LGBTI signs on the boxes, not to call them, or tag the boxes for privacy. And now I'm talking mostly about the clients from remote regions, from small towns, because such clients hide their sexual preferences and sexual orientation from their friends and families, and they need more confidentiality than other clients. And we provide such confidentiality for them. Also, we actually didn't expect this, but SafeBox activity became inclusive for such a group of MSM who have hearing disorders. These clients are most vulnerable. They can get information about self-testing services only in internet, or by talking with social workers with the help of different messengers. And the ability of social workers and clients to communicate in Telegram and Viber allows such vulnerable groups to receive the necessary and very important information for them, also to have some consultations, and this is very important. Next, I would like to dwell on SafeBox activity in the period of COVID. Strict lockdown in the period from March till July 2020 made access to HIV testing services in healthcare and community settings more difficult for our clients. SafeBox activity significantly contributed to the improvement of such access. First of all, HIV self-testing services has become available to hard-to-reach group for closed community of MSM aged 30 plus, who have never used, do not use, or can't use prevention services. Thanks to mail delivery, HIV testing services have become available to MSM from remote regions. In 90% of cases, such MSM have never been tested for HIV. Sufficient stock of the SafeBox products and uninterrupted work of postal services allow to continuous provision of this activity and of testing even during the lockdown. And the use of express mail delivery in one day to any village or city in Ukraine ensures mobility and speed in receiving HIV testing services. Also, we provide some pandemic precautions for our social workers. The organizations received the necessary protective equipment such as masks, antiseptics, gloves, with which they provided not only themselves but also clients who came to the organizations to get the SafeBox. Trainings on how to prepare the client for coming to the organization so that it would be safe for all who are in the organization and work there were held. Temperature screening of all those present in organization was carried out. All public events moved online. Quizzes, lectures, trainings for the clients were held using Zoom or Instagram. And what next steps will we provide and take during the next year? The activity on the distribution of SafeBoxes continues in the new project year from the 1st of October 2020 until the end of September 2021. The filling of the SafeBoxes will change slightly. A tattoo pack will be added instead of stickers and magnets. Temporary tattoo design was developed by a professional tattoo artist, especially for MSM. And you can see here this design, very beautiful design. In the new project year, 3 new MSM organizations situated in Kiev region, Kiev city, and Kryvyi Rih city will distribute SafeBoxes among clients, and we expect to attract even more clients and to provide them self-testing services. We have already presented the results of such activity at the conference for and about teenagers, virtual about real, on September, and also at the 13th National LGBTI Conference in Ukraine on November 2020. Thank you very much for the attention. If you have any questions, please feel free to contact me. I will be happy to answer them.